for being here today. My name is Michael Schwartz. I'm the Experiential Director of Better Spaces. Whether you're watching this live or perhaps you're watching the recap, thanks so much for being here. If you don't know what Better Spaces is a workplace engagement platform for connection, collaboration, and well-being at work. Each week, we bring you fun, educational, and inspirational sessions to help you have a healthier, happier day. So today, we have the first of a new 3-part PT series around building a resilient body. Today's focus will be on hands and wrists. We have, once again, Dr. Paul Kachowa. He received his doctorate of physical therapy from Mercy College and a BS in exercise physiology from Rutgers. His treatment philosophy, which I love, is move better, feel better, and play better. If you have a question at any point, feel free to type it in the chat. We'll get to a few questions at the end, but without further ado, Dr. Paul, take it away.
Thank you, Michael. Hello, everybody. Welcome to our first in the Resilient Body series, where I'm going to be talking to you about how to improve your ability to move, be healthy, and avoid injury. So be resilient. So today, we're going to be talking about the hands and wrists. I'm going to pull up my slide here. And here we go. So I, by no means, am an expert in the hands and wrists, but I do know a little bit about the body. So we're going to talk about how to make your hands as flexible as possible and get rid of some pain. So let's see if I could slide this over. So I always say this at the start of every one of my classes, my webinars, is that because I'm a physical therapist and I've been a PT for over 20 years, this is not physical therapy. So these are going to be some general advice and exercises and stretches that you can do, and it's geared towards the general population. It's not for addressing any specific medical condition. So if you do have issues, please consult a medical professional. All right. So some things that we're going to cover today, some common hand and wrist ailments are going to be the carpal tunnel syndrome, sprains and strains, and arthritis, thumb arthritis. Slide this over. Well, we can kind of group all of those ailments into 2 different categories, whether it's going to be addressing a joint or a soft tissue. And soft tissue is our umbrella term that includes muscle, tendons, ligaments, and fascia, which is all this kind of connective tissue that fills in all the gaps and gives our body its shape. All right. And the other thing that if you're working from home or working at a desk, the other thing that I find with a lot of clients that I see with hand and wrist problems is their posture. Now, your posture controls how you can move the shoulder, move the elbow, move the hand, and move the wrist. If you have a poor posture and you're having symptoms in your hand, that's the first thing that I would check is what is your neck, your trunk position, what's your workstation like? And then that can reduce the stress on your hands and wrists as you're using them and reduce the pain. So that's kind of like the low-hanging fruit, that if you're having issues in the hand, look upstream at the body and see what's going on in here. Sometimes we'll get an impingement issue in the shoulder or the neck where a nerve can get pinched and causes radiating symptoms down into the arm. Otherwise, if it's a carpal tunnel syndrome, where that nerve, the median nerve, gets compressed right into this space right here, that can also cause numbness and tingling and weakness in the fingers. And it's generally into these first 3. All right. So let's fast forward here. So we're going to talk about stretching and soft tissue mobilization. Now, they sound familiar, but they're 2 different things. Stretching is just taking point A and point B, the beginning and end of the muscle, and then just elongating it, just kind of separating it. But soft tissue mobilization is much more effective, or makes stretching much more effective, when you prep the tissue to be stretched. So soft tissue mobilization is, if you think about our structure of our body, we have the skin, we have the dermis underneath, the fascia, the muscles, the bone is the deepest layer, and you have the nerves in there. All those different layers of tissue need to slide and glide over one another. So when we do something called soft tissue mobilization, I'm going to show you how to do it on your own. you can get those pieces, those layers of tissue moving so that they can slide efficiently, especially around the hand and the fingers. Here we go. So you got like a really intimate session today. Usually I've got like the full body when we talk about like back or hips or knees. Now we're just talking about the hand. It's very intimate. There's my hand right here. So all the muscles that can, well, the majority of the muscles that control the fingers are located in the forearm. So this is the first place that I'll start. A lot of times we have this thing called tennis elbow or golfer's elbow. It doesn't really matter what you call it, but you have pain either on the inside or the outside of the forearm. And that muscle, this muscle wad right here, goes into the base of the wrist and basically does this and creates flexion or bending of the wrist. On the other side, these other side muscles here, the wrist extensors, they just do this and they extend the wrist and they also extend the fingers. The other structures that control the fingers, you think about the meat of the muscle is in the forearm, and the tendons are long and skinny, just like ropes. They go through the wrist and they go through to the tips of the fingers, creating the ability to extend or flex the fingers. And at each knuckle, we have basically a pulley, a piece of ligament that keeps that tendon close to the bone and allows that finger to flex and extend. All right. So if we think about the process or the thing that we talked about of sliding and gliding, we want the tendons to be able to slide in and out of the sheath or forward and backward of the sheath that they're sitting in, and also around all these pulleys. So we're going to start with what we call a tendon glide. Okay, so it's pretty simple. Just take your hand. You can start in any position here, and we're going to mobilize the tendons in the hand and wrist so that we can get them loose. So the first thing is that I want you to just take your fingers, and we're going to take the tips of your fingers and then put them all the way to the base of the hand. All right, so that's kind of like the distal knuckle is straight and all the other knuckles are bent. Right, so we're going to go from that. It's like position one. We're going to open back up. We're going to take the fingertips and then take it to the base of the fingers. Okay, so now we've got two knuckles bent and then this one straight. So that's the base of the fingers. And then we're going to bring it out again and then only bend the first knuckle. So that's kind of like our Muppet hand. Okay, so everything is straight here. And then we've got the bent knuckle there. And then we're going to come out straight. And then we're going to do a full fist. And we're just going to curl everything in. So if we go through this sequence by sequence, we do that quick. We just kind of go from base of hand, open, base of fingers, open, Muppet fist, open, and then full fist. We do this again and again. I usually prescribe this movement to a lot of my patients who do have carpal tunnel syndrome, because that carpal tunnel right through here is where all of those tendons glide through or pass through, right? So we want to make sure that's loose. So this tendon gliding is kind of going through that motion, base of hand, open, base of fingers, open, Muppet fingers, open, and then full fist. So you go in and out of this position. I usually have people do it like for a minute or so, right? Just to loosen that up. Okay, so that's a tendon glide. The next one we're going to talk about is some tips on how to avoid carpal tunnel in the first place. So one of our tests that we do to see if there is true compression of the nerve through this carpal tunnel right here is to compress that. And we can just kind of do a tapping here, right? If the tendon or the nerve, if the nerve is very irritated, any type of tapping to that base of the hand right across between the base of the pinky and the base of the thumb is going to cause symptoms. All right. If that feels fine, then we start to compress it with muscle. And then what I'm going to do is I'm going to do a lumbrical grip, which is kind of calls like that. And that creates a lot of compression into the top part of that. Or I can take my hand and then do one of these stretches here. I'm going to show you. So I'm going to take my hand down. And if I hold this position for about 30 seconds, I got my thumb on the other side of my hand here, and then pulling down with my fingers. If I hold this position, this prolonged wrist flexion position, and that causes numbness or tingling in my fingers, and that's a positive test for carpal tunnel. All right. Anytime that we're working on at a workstation, our main focus is to try and relieve some pressure off of that carpal tunnel. I don't want to be like flat on the desk with pressure on there. So any way that I can relieve that pressure, the better. And also trying to maintain a neutral wrist. A neutral wrist isn't a flat wrist. It's kind of like cocked up about, I don't know, 20 to 30 degrees. This is the ideal position for your wrist to function and use implements like the mouse or keyboard. If we're going flat like this, where you're kind of like this in this position, it's not a very efficient way for the muscles and tendons to work through the forearm, wrist, and fingers. And that can cause repetitive stress injuries or strains like carpal tunnel. So if we have this neutral position, if I wanted to really take away some of that pressure off of that carpal tunnel, I could prop up my my forearm so that I could work in this position here with my wrist totally unsupported. So I have my forearm supported, I've got my wrist, and I'm working in that position. So there's like mouse pads that you could use and stuff like that. There's also different types of mice that you could use, like a trackball instead of a moving mouse if it's pretty severe. All right, some simple stretches. We talked about, like, if we're going to stretch, a stretch is much more effective if we prep the tissue via soft tissue mobilization. So one of the ways that I like to use, you could use your fingers in here too, but I like using a lacrosse ball because of the tackiness of this rubber. It actually helps to create more of a glide to the tissue. Okay, you could use a tennis ball, but the tennis ball's felt covering isn't as effective. So I usually start on this medial side, the inside of the forearm, and those are all the strong muscles that bend the wrist and the fingers. And I'm just going to come in here. And what I'm doing here is I'm not really rolling the ball. You can certainly roll through that tissue, but I like to kind of shear. So if you can kind of take a closer look here, I'm using the rubber of the lacrosse ball, catching the skin and then sliding. So I'm creating a tissue slide and enabling that glide of that tissue of the deeper layers. I can go up and down, left, right, and I'm searching for the different areas and different directions where I feel the tightest. So if I can kind of go up and a little bit up and towards my wrist, I'm going to go up and down. I can go left and right and just feel the quality of that tissue. Quality is how much does it slide left to right? How much does it slide up and down? And if I find a position or direction that is a little bit restricted, like say I'm a little bit tight at this area in the downward direction or towards my elbow, I'm going to maintain a lot more pressure through there and then pull and create a shearing as I'm pressing there. And I'm really just pulling the tissue. And then I'm going to take the fingers and wrist and then pull in the opposite direction. All right, so I reposition, I create that shearing pressure, and I pull in the opposite direction. So this is a tack and stretch technique where I'm tacking down the tissue and then stretching out the other tissue. Now I'm doing it here with my elbow bent. If you do it with your elbow straight, that's going to create a different sensation because fascia, the connective tissue of our body, runs in lines. From the tips of our fingers all the way to the inside of the hand, that can go all the way up into the neck and to the inside of the shoulder and pec. So all of that fascia is connected. So depending upon your elbow and shoulder position as you do this, you can feel different sensations in terms of where your restrictions could be. And I could repeat that on the other side as well. All right. So I could certainly start with rolling. That's very easy. But I think that the shearing of the tissue with the rubber coating on the lacrosse ball tends to be a little bit more productive in terms of improving mobility of that tissue. And you could tack and stretch that side too. So I'm going to hold that down and I'm going to pull my fingers away, and that stretches out that backside of the tissue. And then once I'm done with that, you can do the simple stretches that you've probably seen before, where we're just taking the fingers and wrists into the opposite direction and pulling. Here I'm stretching the inside of my forearm here, inside of my forearm, and the wrist and fingers that bend. So I'm just kind of pulling back that way. And we could do the other one that we talked about earlier, which is a test for our carpal tunnel syndrome, which is a wrist extensor stretch like this. So the stretches, I want to hold them for at least 30 seconds. 30 seconds is the magic number to create prolonged elasticity and length through that tissue. Anything shorter, studies show that the tissue just kind of snaps back into a shortened position. So to make it a permanent lengthening, we want to hold that stretch for 30 seconds. Now, this is a good test too, because this area right here at the base of the thumb, I find is one of the hot spots for a lot of my clients that develop arthritis in the fingers. We use our thumb all the time. And that joint right there, the metacarpal phalangeal joint, tends to be the one that gets fired up a lot and gets angry. One of the tests that I do is if I just put my thumb in the middle of my fist, and then I take my hand and then pull my pinky down into the downward direction. If that tends to light up that tendon on the base of my thumb here and gets really painful, that means that's tight. We need to loosen that up, and I can release that. So to loosen that up, you can certainly get your lacrosse ball and then kind of go over those tendons. But I prefer, because it's such a tiny little spot here, right at the base of the thumb, I tend to just use my fingers, just trying to going up and down. Again, looking at the shearing quality of the tissue, how can that slide versus just kind of like a light type of massage, okay? So that's how we can get into the tendons as we get closer into the hand and the digits. Do the same type of sliding that we do here, just like type of massage and get things moving. Another one is to create another technique to reduce pain at the thumb is to create more space at that joint. Okay, so we have a wrist joint or a carpal bone, which connects to a phalangeal bone, a digit. And if we can open up that space, we can relieve some maybe arthritic type issues. And by the way, arthritis, is inflammation of a joint. If you, no one can escape it pretty much. If you're human, you'll probably have arthritis at some point in time because you use your joints, and that wear and tear is going to cause some type of discomfort. But the way to prevent that from happening is make sure that you have full range of motion, full flexibility, and strength. So the last thing I want to talk about is just opening up this joint via joint mobilization. So I'm going to take my hand, my other hand here, and I'm going to grasp that base of my thumb. So not just up here, I'm going to grasp that with my hand, right? So I get a good grip, and you could see like this the divot that's at the base of my hand. And if you palpate that and feel that there's like a bump, and that's the base of your thumb bone, we're going to put that base of your thumb bone as I'm holding the thumb. I'm going to back up here. I'm going to show you this on my other screen. I'm going to put that base of my thumb right on the top of my head. I had an occupational therapist show me this exercise, and she called it the skull rock. It's basically taking the base of that thumb, meanwhile having a good handhold of that thumb. And if you put that base of that right on top of your head, and then relax your arms, the weight of your arms will create that separation of that joint at the thumb joint. And the pressure of your skull on the thumb will create a little bit what we call a glide. We're taking those joint surfaces and then gliding them back and forth. All right, and then we just kind of hang out there. So we get a little bit of distraction. This can be a little bit painful. If you do have sharp pain, don't do it, or reposition and try again. But definitely the things that I usually prescribe to people, it should not hurt. It should make things feel better, right? So we do that for about a 20 to 30 second hold for that, kind of rocking the finger back and forth over the top of the skull and trying to relax the arms and allowing the weight of the arms to open up that thumb. And that should make the thumb feel better. All right, so hopefully all of that helps. If you do have symptoms, again, something specific like a trigger finger or a fracture or something, I would refer you out to a hand specialist. The hand is probably one of the most complex parts of the body, and there's therapists and occupational therapists and physical therapists that only specialize in treating hands. All right, so hopefully that was helpful. You have any questions for me?
Thanks, Dr. Paul. Any questions? We got a few minutes left, so if you have any questions, any follow-up?
There's one there about the trigger.
Are you raising your hand?
Yeah. can I ask what he can suggest for this joint that's all swollen and it only hurts sometimes, not all the time? But can he suggest an exercise for this joint here on the index?
So that's like the most smallest knuckle over here.
Yes,
All right.
it's
so
all
you think-
swollen.
Yeah, so think about, like, I think that swelling in the digits is probably one of the toughest things to control, because usually what we do to reduce swelling is what we call a retrograde massage, which is basically squeezing and pushing that fluid to the central circulatory system. So from the fingers, that means pushing that fluid back into the base of the hand and the wrist, and then up the arm and into the shoulder and to the trunk. If that's swollen, we have to figure out what's causing that swelling. There could be reasons underlying, like systemic reasons, of why that digit is swollen. From a musculoskeletal standpoint, the massage and that cross friction, the soft tissue work you can do at that digit, there isn't any tendon above that knuckle. The tendon that moves that knuckle is below that knuckle. So if we're going to try and maybe improve the ability for that distal digit to bend, we would do that massage right below that.
All right.
Okay, and you're saying I should massage it going down?
If you can, like I said, it's a very tough area to control swelling, because there could be several reasons why you have swelling, and it might not be just excessive fluid. It might be something systemic. So I would always suggest that you find a hand specialist to go and see, so they can take a closer look at it.
Thank you, Dr. Paul. Thanks for the question, DC. We have two questions left, one from Joan over here. Joan, I see you're asking about the trigger thumb. Is there anything specific?
Is that this thing?
Well, I already had a cortisone shot like about a year ago, but now the pain's come back. So, and it's my left hand and it's hurt.
So we have to figure out which of these joints is the tendon getting caught up on. So if you hold this thumb and then just do that, if that feels fine, then that pulley right there at that knuckle is clear, right? So we're not getting any caught up in there. As we get closer, the base of the thumb, there's a whole bunch of muscles and tendons that cross there. So it's tough to figure out. If you lock out the base of your hand like this and then start to move that thumb, you can see how it goes in and out. It can do circles, it can go across, it can extend. So that's a tough one to figure out, because you have to isolate which tendon is typically, when we talk about a trigger finger or trigger thumb, that signifies that the tendon has a nodule, some type of inflammation in the tendon. And as that tendon passes through one of these pulley systems at the knuckle, it's getting caught. You think about like a rope with a knot in it. And if you try and pull that rope through something tight, it's going to get caught up on that knot. And that's what that trigger thumb or trigger finger is. Figure out where that nodule is. It might be on the back even, that limits your ability to flex this way as it lengthens over the tendon or over the pulley. And you figure out where that knot is, and you try and do a cross friction massage, we call it. We just take, if the tendon runs straight up and down, we're going to take your thumb or another finger and then massage it across the fibers. You think about like you're breaking up the adhesion, that nodule, by going across with some pressure.
Thank you. Pedro, I saw you raised your hand. Let's get to you in just 1 second, because we have this question from Chelsea B, and then we'll wrap up for the day. So Chelsea's question is, any advice for residual pain from a healed wrist fracture?
Oh, that's a good one. It's be complex. A healed wrist fracture, if you think about like what type of trauma, there is this syndrome called complex regional pain disorder, where the central nervous system has a heightened sense of, or a heightened threat of stimulus, where it can interpret even just light touch as being pain. So if that's what's going on with the hand, if there's residual pain and an increased sensitivity to the area, my suggestion is to try and decrease the sensitivity by gradual exposure to certain stuff. So one of the things that I like to do, especially, and this works well for like post-surgical scars where, you know, they cut through this, the tissue, the nerves, the superficial nerves are like all irritated. We take the area that you're having the symptoms and we take a towel or some type of material and start to rub it. And, you know, think about like just with lifting weights or exercise, we start to increase the noxiousness of that material. So this is like a soft towel. We'll start to rub maybe about 30 seconds to a minute. And then maybe we'll grab something that's rougher, maybe an older towel or some type of burlap. And then we start to rub that area. And that conditions the nerve to tolerate stimulus without interpreting it as being pain. So that's a complex question.
Thanks, Chelsea. Okay, last question of the day from Peju about finger stiffness. Anything to help alleviate when fingers suddenly get stiff and you can't hold anything or pick something up? Any exercises or things to do to alleviate that?
So the first thing that we went through today was that the nerve glide, right? So the nerve glide is one of the things that I give people to do who have stiff fingers. You go to the base of the hand, base of the fingers, make that Muppet fist and then a full fist. So if you go through that sequence, that will help to reduce the stiffness in the fingers. You could also do dexterity stuff like taking your thumb to every finger. See if you can go touch the tips of your fingers. See if you can touch the distal knuckle on each finger. See if you can touch the proximal knuckle on each finger. I'm doing this in the camera. You can see as I'm going through each digit. So that should help with the thumb dexterity. But I feel like the tendon glides help to loosen stuff up. And you could also do, like I've had people do like a bowl of rice. You heat it up. It's not cooked rice, right? So it's the raw rice. You make a little heat. You put your hand through there and that heat will help the elasticity of the tissue. There's another thing called a paraffin bath. That's PARAFFIN, a paraffin bath. You could look it up on Amazon. It's just melted wax that you dip your hand in. It creates like a wax hot glove, which feels great on the hand and is great for your skin. So that's another thing that could help improve your mobility around your fingers.